Hi, I'm Van Luque. I'm a biomedical engineering student at Universitat Pompeu Fabra, and I'm currently doing my bachelor thesis, which is called Computer-Aided Detection System for Pulmonary Embolism with Integrated Cardiac Assessment based on Embolic Burden. It is a bachelor thesis supervised by Gemma Piella and Mireia Macias, and it's about, first of all, pulmonary embolism. So what is it? It is a common treatable illness, which is caused by a blockage in one or several branches of the pulmonary arterial vasculature, uh, which means you can see it in here in the first figure. There's a blockage that alters the correct blood flow and the blood supply, and generally it is due to a deep vein thrombosis. Some features about pulmonary embolism: it is the third most common type of cardiovascular disease. It has an incidence of 60 to 70 per 100,000 inhabitants, and it produces effects on pulmonary and cardiac function. And we need to stop here for a second for the cardiac function and cardiac structure, in fact, because what happens if a patient has some pre-existing cardiac disease? Well, it will happen that it is sensitized to the effect of pulmonary embolism, right? So the pathology itself will be worsened if a PE occurs, and this is highly concerning. So far we can more or less say that there is a relationship between cardiac function and structure with respect to the features of the pulmonary embolism. Keep in mind that the pulmonary embolism can be just total, partial, one branch, several branches, different locations. So there's more kind of a wider spectrum here. And in fact, some studies have pointed out that if you measure this with some score, it relates to cardiac features, for instance, right ventricle to left ventricle ratio. About the diagnosis of PE, it is mainly based on imaging and particularly CTPAs, right? You can see in here a slice of this CTPA, and it is that these images are whole volumes, so radiologists need to go back and forth and try to check each of these slices, and this is an arduous task. For this reason, computer-aided detection systems, or CAD systems, have gained attention as they can work as second readers and help radiologists to alleviate this arduous task. And the idea of this bachelor thesis is mainly creating a CAD system, right? So we want to automatically diagnose PE, but also implement these relationships that we have found interesting between the embolic burden, in this case, the embolic burden on the images, and cardiac features. So the idea is that for the images we analyze, we will get right ventricle to left ventricle predictions depending on the embolic burden. And if there's a mismatch, the idea is that we hypothesize that this mismatch is due to hidden cardiovascular disease, which in fact would be helpful, right? In this case, would be useful to inform radiologists of this situation, as they would manage the patient quite differently. So for this bachelor thesis, the idea is that it is divided in three different steps. We will first replicate these experiments of correlation between embolic burden as a score and cardiac features. Then we will explore the idea of predicting cardiac features from CTPA volumes, in this case, predicting right ventricle to left ventricle ratio. And finally, we will build a CAD system for automatic PE detection that also involves this module of cardiac assessment. And that's it. Thank you so much.